My name's Jeff Gauvin, and I'm a surgeon in Santa Barbara. I've lived here for about 3 years, and I'm being interviewed today by these excellent young students.
What do you actually do on a daily basis?
A typical day, I'd go in the hospital in the morning, and I would round on my patients that were in the hospital. I might not have anybody in the hospital, or I might have 10 patients in the hospital, depending on what my week had been. Some of those patients would be recovering from surgery. Maybe some were recovering from a trauma that they were in. And others might just be in because I'm observing them or trying to figure out whether we should do surgery or not. Then maybe in a typical day I might go and do a couple of elective surgeries, maybe a hernia repair, a gallbladder removal. And then if I were on call, then I would have to be, on that day, anything that came in through the emergency department, I would be the surgeon on call for. So that would be maybe somebody with appendicitis, or maybe they were in a car accident, or they were shot or stabbed or something like that. And then I would have to tend to those people.
So where do you work? Do you like your work environment?
I work most of the time in Cottage Hospital, and I like that very much. I have an office that I spend a lot of time in. I spend a lot of time on the wards where all the patients are, whether that's in the intensive care unit or the regular rooms in the hospital. Then I spend some of my time in the operating room. And then I spend some time at a county clinic. Once a week I go out and staff a clinic where I take care of kind of the underserved.
How has your career changed since you began, both personally and as an industry?
Oftentimes my days are much longer, or when I come home, even if I'm not on call, I may get calls about patients that I know, patients of mine, and maybe somebody I'm worried about, and I have to go back in and see them. So I think you have more demands on your personal time outside of work, and so that's a big change, but medicine is a big commitment, and that sort of goes with, I think, being a good doctor, is you have to sort of give up some of that free time, but on the other side of it is, I think, what you get back from that can be very rewarding. I've always worked for universities, and this is the first time these 3 years I've spent in Santa Barbara that I haven't worked for a university. And so that part of my personal industry has sort of changed. Medicine as a whole, there's some big health care reform going on right now, but so far we haven't really seen the effect of that yet. And so we're kind of up in the air. I'm not really sure what's going to happen with that, but either way, I'm going to continue taking care of people that need to be taken care of.
What is it like doing residency?
Residency was really, really, really tough. Now we have, there's work hour restrictions, so if you're a resident today, you can't work more than 80 hours in a week. You have to have 1 day off a week. You have to have certain time off between your shifts. When I trained, we didn't have that. And I'm sure there were many weeks where I worked over 100 hours in a week. It was not uncommon to go 36 hours without any sleep.
Do you recommend that others follow in your footsteps?
Follow your heart and be passionate about what you're going to do. And if you're going to go into medicine to make money, that's ridiculous, because there's way easier ways to make a lot more money. And that you just sort of need to be passionate about it and be called to it. Because then when you work hard, you're doing something you love.
What do you love or hate about this job?
I love being able to help people and working with people. It's a very intimate relationship. You might be have a perforated appendix, or maybe you were run over by a car and you need emergency surgery. And when you meet somebody in that situation, it sort of strips away all the baloney. The worst thing about the job is that when something goes wrong and we make a mistake, you can really hurt people. You can really have a devastating effect to somebody's life.
How did you become interested in becoming a surgeon?
It was just really cool. It was just really fun. And when you're in medical school, you rotate through all these different specialties. You rotate through pediatrics and family medicine and internal medicine, obstetrics, psychiatry, surgery, and all these different things.
Out of all the types of surgeon, why a gastrointestinal surgeon?
I'm pretty much just a general surgeon. But I knew I wanted a career in teaching, and so I wanted to do a fellowship or get some extra training that would still keep me in the realm of general surgery. Like, I didn't want to become a plastic surgeon or a colorectal surgeon or just a trauma surgeon. I wanted to do something a little bit more. So I did some advanced training in kind of bigger GI cases, and I thought that would keep me a good broad based general surgeon with maybe a little bit extra to offer.
How did you get to where you are from the beginning?
I went on and became a biologist outside of when I graduated from high school. I pursued that and actually got a graduate degree in that, and thought I was going to go on and maybe get a doctorate degree. But what happened was I began to have some doubts and decided that maybe I wanted to pursue a career in medicine. So I actually took a job in teaching in Europe, and I did that for a couple of years, kind of sorting out what I wanted to do. And at the age of 30 is when I decided for sure I wanted to go into medicine. So I had to come back and do all my pre-med courses. I worked as a researcher for a while I did that, and then I started medical school when I was 33. I was almost 34 when I started medical school, so that was about 10 or 12 years older than most people. And then 4 years of medical school, I decided to be a surgeon, 5 years of residency, and then I did a fellowship for 2 years. So that's a lot of training. So I was in my 40s by the time I was done with all of that training.
Who do you work with, and how often do you collaborate with them?
There are about 10 other surgeons in town, and there's a couple that I work more closely with than others. One in particular, and we collaborate almost every day. We talk about different aspects of our job together.
What might have you done differently looking back?
I probably would have studied a lot harder earlier on in my career.
Where do you see yourself in the future?
In Santa Barbara. I've been kind of a free spirit, and I've traveled around a lot and moved around a lot, but this just seems like a good place to stay.